This alternative intervention presentation is on aquatic therapy and will discuss the necessary training, the basis for treatment, the potential pros and cons, along with the targeted population for aquatic therapy.
The origin of aquatic therapy as a medical treatment dates as old as mankind, so looking at it as a timeline best shows its progression through time. First, in 2400 BC, people in Asia and Greece immersed themselves in water for healing and religious purposes. Also, the ancient Greek physician Hippocrates talked about the benefits of bathing in spring water to alleviate the symptoms of various illnesses. By 1500 BC, water was used to treat fevers. In 800 BC, Bath, England became a hotspot for healing through bathing. Next, in 500 AD, aquatic therapy and bathing in general fell out of favor due to new religious views. But in the 1700s, water came back into fashion with the emergence of hydrotherapy developed by German doctor Sigmund Hahn. He used it with patients who had muscle spasms, and then cold water was used to reduce fevers. In the 1830s, a Sicilian peasant, Vincent Presnett, combined cold water and a vigorous exercise program to strengthen patients who were ill. In the United States, hydrotherapy was developed as a treatment modality for neurologic rehabilitation, initially in response to the polio epidemic, and then for treatment of amputees following World War I. And now, it can be found in nearly every sports complex and health facility. Over time, new names to describe water therapy were created, new methods of treatment were discovered, and novel equipment was fashioned. But overall, aquatic therapy principles have largely remained the same.
Currently, beyond the therapist's degree, there are no other educational requirements or certifications necessary for the use of aquatic therapy. However, if the therapist decides, they can choose to take continuing education courses to expand their knowledge and skill in that area. And if a therapist is using aquatic therapy, this is heavily recommended in order to provide patients with the best possible care and use aquatic therapy to its fullest potential.
Next, we're going to talk about the basics of aquatic therapy. So aquatic therapy is going to consist of the pool, various types of exercise equipment that's designed to be used in the aquatic environment, and then also the therapist that will guide the treatment session. That being said, aquatic therapy is unique in that it can help patients struggle to perform on land, mainly due to the effects of gravity on the weight-bearing structures of the body, and namely the joints, to perform exercises that they normally wouldn't be able to. The buoyancy of the water alleviates some of the pressure on these weight-bearing structures and is what can allow these patients to perform activities, exercises that they normally would not be able to do. In addition, properties of the water can create light resistance that can be utilized for exercise purposes, including strengthening of muscles. And finally, the temperature of the water is usually kept between low to mid-90s, which means that there can be a relaxation effect, and this can be utilized especially for patients with spasticity, where it can help to relax the muscles that are being used.
The advantage of aquatic therapy would be the environment. So if someone had access to an outdoor indoor pool facility, this would be an advantage, especially for someone whose body is not well conditioned. So for an example, like a stroke patient who has a tendency to overheat, the water will help relax, cool down the patient when doing his exercises. Another advantage would be the buoyancy of the water. So the buoyancy in the sense that you're not going to be able to feel a lot of weight bearing on your joints and muscles, and this will help release some stress from your joints and muscles. Another advantage would probably be the warmth and relaxation of the water. So in a sense, to relax the muscles and to increase blood flow during exercises, which is what we want. And then also resistance of the water. So this will help aid in strengthening muscles during exercises. Some disadvantages would be the chemicals in the pool. So chemicals like chlorine, the patient may have low tolerance or may be allergic to chlorine. This could be a disadvantage. Another disadvantage would be water versus land. So you're going to be in land for the most of your life. So when you're doing aquatic therapy and you're in water, you're not fully weight bearing. You're not feeling the stress on your joints and relaxation. So the transitioning from the water to land is going to be tough for the patient.
Aquatic therapy can be utilized in many different patient populations. One specific population would be in cerebral palsy patients, such as a patient with hemiplegia, diplegia, or quadriplegia. One of the main issues with these patients is just normal upright walking. So through aquatic therapy, you could offload the tissue through that buoyancy term discussed earlier. This would allow for a quicker reestablishment of the gait pattern that is more normalized with more proper mechanics. You would also not utilize an assistive device in this environment, leading to quicker establishment of ambulation assistive device free. Strength training benefits for this patient also occur in this environment because in the aquatic therapy they can go through a greater range of motion and provide greater strength benefits. Another patient population that aquatic therapy is beneficial is in spastic patients, so utilizing cold water will provide an inhibitory effect to the muscle, decrease that muscle tone and ultimately decrease their spasticity. Another patient population that aquatic therapy could be used for would be post-operative patients following a knee replacement or hip replacement. So generally, following these replacement surgeries, you'll have a specific protocol that you have to follow that determines the weight-bearing percentage that patient can have. So this could be utilized with aquatic therapy because at ASIS level, you have offloading of 50%. Xyphosternal level, you have a 70% offloading in the water, and at C7 level, you have a 90% offloading in the water. You could then follow the progression as needed and then progress your patient as you need it through the water. Another patient that this could be useful for would be a patient with arthritis, such as osteoarthritis or rheumatoid arthritis, because this would provide an additional offloading effect as well.